says pre-live.
My screen still says pre-live as well.
Oh, lucky. I might see. Oh, yes, so does mine. Live.
Yeah, there we go.
There we go.
I think
Sorry.
we're now live. So, ladies and gentlemen, in the absence of the leader, who I think is likely to join us but may be delayed, we do need to nominate someone as chairman for the moment until he's able to join us. So we will need a nomination for that, please, if I may.
Nominate you, Stuart.
Thank you. Any other nominations? No. Right. I obviously didn't step back quite quickly enough on this. Okay. Thanks very much. So, first item that we have on the agenda is the minutes of the previous meeting held on the 14th of January. Has everyone firstly read those minutes and are happy that they are an accurate record? Yes, I see nods coming round. I will be guided by Jane as to whether we need to take a formal vote on that, or we simply by assent is enough. Yes, I think by assent is enough. So we're all happy with those minutes. Thank you for that. The next item on the agenda is declarations of any interest. So have members any interest on the items on the agenda, pecuniary or otherwise? No, I see heads being shaken and I've got none either. So thank you for that. That brings us on, obviously, to a public question time, item 3 on the agenda. I'm unaware of any questions that have been put in writing to the Outbreak Engagement Board. Is anyone else aware of any items? No, I see.
There are no public questions, Chairman.
No public questions. Thank you. Gosh, zipping through this. Well, then we get to the meat, really, which is item 4, which is the update on our current situation. And normally we get information here about the Isle of Wight public health data. And I'm not sure who's going to take us through that. I'm looking to see if Simon is on the call, but I can't see his indicator. Chief Exec.
Thank you, Chairman. I think that our plan for today, unfortunately, Simon's been delayed. Obviously, with a fast-moving pandemic, things are moving very quickly for him. He is going to join the meeting at 1 o'clock. So the suggestion is that we take the other items on the agenda and then adjourn and come back at 1 o'clock for Simon's update. Okay,
yeah, that's fine. In which case, as item A is the update on public health data. That obviously clearly will be Simon. Item B, 4B, is an update from Simon, so that one we will defer. Which brings us to item 4C for the moment, which is the update on the communications activity in connection with the pandemic. And I think we are receiving a report from our Assistant Chief Executive, Wendy Pereira. So over to you on this one, please, Wendy.
Thank you, Chair. Our comms and engagement activity has continued very much in the same vein as reported at last month's Outbreak Engagement Board. We have 3 main pillars to that. The first is the re-emphasising of the key messages from government around staying at home, only undertaking essential journeys, being clear about what those essential journeys are. We have a second pillar, which is about introducing COVID stories. So that's actually people on the island who have been impacted by COVID and who have been prepared to provide us with information and undertake interviews and podcasts for us, just to give everyone else within the community an understanding of how people are being impacted and how people aren't alone in dealing with the pandemic. And then the third issue is in relation to making sure that the information we put out is very factual and very clear about COVID and vaccinations and COVID facts. I think the COVID fact issue is really important because it's not about creating a sense of panic or scaremongering within the community. In fact, there's some very clear research throughout various emergencies and crises situations that's clear that the public are not necessarily panic prone in times like this. They do like to know information and they do like to make informed choices. And actually what we've seen on the Isle of Wight is a really good example of how public do respond to a crisis, in that kind of altruism and helping others comes to the fore. And we have really seen that on the island in the last year. And so we are taking forward that messaging in terms of providing COVID facts for that reason. One of the issues that I know members have discussed previously, and something that we've picked up on through commenting on social media, is about adherence to the behavioural regulations that are in place. And in actual fact, adherence to those regulations has remained good in the main across the island. And this is despite the fact that we know people are suffering considerably, both financially and psychologically. It's very easy to judge incidents of events based on how easily they come to mind. And violations or non-compliance are both more memorable and more newsworthy. So what we tend to find is that we hear a lot about non-compliance, which makes it feel as though there is a lot of non-compliance, but actually across the island, compliance with the guidelines has been generally very, very good. And I think that's reflected in the information that Simon will give you later in terms of the impact that that's had on the spread of infection across the island and the way that that has changed dramatically since Christmas. I've already explained that our COVID stories have been really well received, and we will continue to undertake those going forward. And then I think the point that we've reached in our community communications and engagement plan from here on in is to think about the future, to think about forward planning as we move forward to what we know is half term. And we've already started to do some work around half term. We had the announcement and the statement that was released earlier this week about the fact that half term is not a holiday in the normal sense of the word as we would understand it. We are still under the guidelines. It is still about stay at home. That doesn't mean that you can't go out for a walk with your children or take your children to the playground, but we still need to be careful. We still need to hands face space. We still need to socially distance, and we still need to make sure that we are not mixing outside of our bubbles. All that really good stuff that's had a really good impact on the spread of infection across the island that Simon and our Director of Public Health will give us some more information on later. And then the other issue that we're looking at is the communications around the lateral flow device programme that's likely to come on stream early next week. Huge amount of work and input from the team in preparing for that. Again, Director of Public Health will give more information on that, but we are prepared to send information out as soon as we get the go-ahead from DHSC that we have a programme that we can put in place. And then finally, we are thinking about the week of the 22nd of February and what we anticipate to be government announcement around easing out of lockdown and how we best respond to that moving forward, both in terms of reflecting the messages that are coming from government, but also thinking about how we can support our community as well, both through understanding where help can be sought, and also thinking about advice and guidance in terms of how we can all prevent the spread of transmission as we start to be out and about more, and just thinking about the positive stuff that we can do as individuals and as families to put ourselves and everyone else in a really good position moving into post-lockdown. That's my report for this month. Thank you, Chair. Happy to take any questions for members, or happy for members to raise any issues that they've had raised with them that they think we need to consider through comms and engagement.
Okay, thanks very much, Wendy. I'll just briefly bring the leader up to date with where we are on the agenda and why, and then I'll defer to him as chair and then go to members for questions. What we're doing, leader, is taking item 4C on the agenda first, because Simon Bryant is unavoidably delayed and expects to join us in about 45 minutes. So once we have handled any questions on the or discussion on the communications issue, we may have to temporarily suspend the meeting until he's able to join us and pick up on items 4A and B. So I will defer to the chair. You can call me Jackie Weaver if you like. I will defer to the chair to handle the remainder of the meeting, but firstly I will ask for any comments from other members present on the Assistant Chief Exec's report on the media strategy, if anyone has any. Over to you, chaps.
No,
No?
thank you, Stuart. Just a couple of things before we go to members' questions, and I don't know what members' questions there be. I don't know whether Councillor Mosdell wants to just indicate what she's probably going to give more detail on this evening in terms of the mental well-being approach we're now taking, because we've talked about the impact of COVID on that, and also the long COVID, which I suspect Simon Bryant will talk about today later. But I just thought the opportunities there, we have a little bit of time, we'll deal with that. And then the other one was to obviously thank you for standing in my stead while I managed to cope with the technology that let me down a little bit this morning. So they were there. So Claire, did you want to just come in on that? Just give it a few seconds for it to come live. You're live now, Claire. But you are muted. Ah, you're clear. Good.
I'm not muted. I'm fine. Yeah, I do have a speech to give this evening, so I don't want to reveal everything now. I think the most important thing is that we have already decided that we are going to expand on the work that we've already been doing for the last few years on working and improving mental health for island residents. I think some of it has to emphasise some of the really good work that we have already done, and how we've already been working integrated with the health and the clinical commissioning group on improving things through the process of our ICP. I think some of the really good stuff that's going to come out will be with our assessment hub that is going into Barton for the homeless, but more importantly is just that expanding on the mental health stuff that we've already been doing. We have to understand that there is nobody who hasn't been affected by COVID. There is, I did give an example the other day of how many people are becoming homeless or leaving their homes through domestic abuse, and how difficult it is during this period to actually be locked up with someone for such a long period of time. As I said, I'm quite lucky that my husband goes out to work at 6 o'clock in the morning and doesn't come in till 10 o'clock at night, so we don't really have a chance to have an argument. But it is really difficult when people are confined, and also that other effect of people who are actually on their own and have been on their own for such a long period of time now. So the fallout for mental health is going to be massive, and as a local authority we need to expand and address on those issues that have already, are being highlighted, and those issues that were already there before COVID and actually just being emphasised even more during this situation. People are afraid. My mum, for an example, who has had COVID, has had her vaccine. She's really been affected by this. And I don't know if it would take a lot to her to go and do the volunteering and the stuff that actually made her quality of life as an 80-year-old, was a very young 80-year-old. She says she feels an old 80-year-old now coming out of COVID. But I think we have to also remember that we're not at the end of this pandemic yet. So as much as we can talk about mental health and what we're going to do about the situation, we need to have to realise that we've got lots more work to do just to get us safely to the end of this pandemic before we can start really integrating together again. I never know if I've said it right, because I'm not sure if the chief executive is smiling, but Wendy is slightly, so I'll leave it there.
No, that's fine, Claire, and I think it gives, for those people that would like to get a bit more information, obviously I welcome them to join the cabinet meeting, which will be public meeting this evening, and they'll hear the full picture. I also thank Wendy for reminding everybody of the point you made. This pandemic is not over yet. Actually, I think we're at quite an important stage in that we know that our numbers are coming down, but they're not down where they were. Simon will tell us the whole picture when he comes on at 1 o'clock or thereabouts, and it'll be informative. And we know our vaccination program is going well on the island, but now is not the time to take your foot off that pedal. If I can get that message to everybody, I'll be extremely pleased that we're doing that. I did have one question for Gary, but he wasn't expecting this question, so he may not. Just interesting how the community enforcement and community engagement's going from your perspective around the community safety. I don't know if anything you've got to add. I do appreciate that you didn't have that question planned.
It was a question that I've asked of the officers. I haven't actually had a chance to review their answers yet, so it is there. It's sitting in my email inbox, and I'll be able to update a bit more later at cabinet. The one thing I will say is that we've got, as we did previously with businesses, is we're going to be hosting some webinars around how businesses can remain COVID safe, etc., etc., etc. That will be going out in a media release with all the relevant details shortly.
Okay, that's good. So again, it may be useful for people to tune in this evening. Thank you for that, Gary. It'd be good to get that. Stuart, did you want to come back in?
Thanks, Chair. Yeah, a quick comment. I mean, firstly, the message I take as a general one from the council and that Wendy has reinforced is that we have to keep promoting the same messages until the situation eases. And that's the general public service message. I would just like to say that we are also getting individual communications now as the vaccination program rolls out. And because I'm probably the oldest and most decrepit member of the cabinet, I have had a vaccination, and I would like to say publicly in this venue how effectively that was administered by the staff and volunteers. My vaccination was of the Oxford vaccine, and it took place at the West Wight Sports Centre. It was extremely efficiently managed, and all credit to those that were involved. No queues, straightforward. But importantly, on the communications issue was that not only was it very good in the first place in the invite, but subsequently we were given, all those who had the vaccination were given printed information about the vaccination and how they should continue to behave, which has been very useful, very clear. So that was good. And also for those who wish to, there is an opportunity for those who've had the vaccination to participate in follow-up information by providing data to a central point, which will allow them to assess how what the side effects are, if any. I have to say mine were very mild, a sore arm and a headache, less of a headache than I normally get in cabinet meetings. So very limited. And they will be taking information from everyone who's participating in that survey so that they can get more data about the effectiveness of the vaccine. So we're now getting both the broad public messages going out, but as more and more people get vaccinated, I think 13 million so far, then we're going to be getting all of those individual messages out too. So I have to say that the vaccination work has been absolutely splendid, working well here on the island, and I think nationally too. Thank you, Chairman.
Thank you for that. Claire, you indicated just one more point you want to make.
Yeah, thank you, Leader.
You're live now.
Thank you. Yes, I just wanted to emphasise one thing. We are starting as councillors, and it won't just be cabinet members, but all councillors are starting to get emails relating to conspiracy theories and the lockdown isn't necessary. And I think we all have to understand that, you know, all councillors have feelings, and, you know, and we're all going through our own individual battles. You know, we might be appearing on these screens, but, you know, every councillor, you know, all 40 of them are working really hard, you know, to actually represent their community. It is really difficult when you get those emails saying that, you know, it's all a conspiracy and COVID isn't real. I know when I've received some, I've had 2 today, and I know I really struggle with that, because actually the truth is I'm very lucky that I've still got my mum. She was 80 years old, and really COVID hit her really hard. When you've got the ambulance out twice because her oxygen levels are dipping, that you have your daughter who has COVID and your granddaughter who has COVID, and when your mum is actually not well enough but not infectious enough for you to actually be able to go in the house and see her, to be able to tell her that one of her friends has died from COVID, you know, this is not a conspiracy. It's not pretend. This is really real. And I know nobody wants to walk in somebody else's shoes, but you want to have a few days of walking my shoes over just after Christmas, when my mum was so desperately ill, to understand how real and how scary COVID really is. So we do need to not be complacent. It is not a conspiracy, and we are all doing our best to try and keep this community safe. Thank you.
Thank you for that, Claire. I think you make that point extremely well. Can I say to any conspiracy theorists who want to send me an email or a Facebook, don't bother, because I shan't reply to you, because I totally agree with Claire. And we can all know of people. I know I was speaking to somebody yesterday who lost a family member only in the last couple of weeks. So I'm absolutely, the message is this is real. We want to get through this. We are getting through it. Tremendous work going on. And we'll leave those people flagging behind, because they're not the kind of people that we want on the island giving those kind of messages. Chief, is there anything else from you? I don't think we've got any members' questions that have come through. And if there's nothing else, I will then probably adjourn until thinking 1 o'clock. I'm just checking with you. That's correct.
Yeah. Thank you, Chairman. No, nothing specific from me. I would suggest we do adjourn until 1 o'clock, and then we'll have Simon for his report.
Thank you for that. So, Simon, if you wouldn't mind, as our Democratic lead, adjourning us until 1 o'clock, and where we'll resume. And to members of the public listening, come back in at 1 o'clock.
Yep.
And Chairman, just a reminder that obviously the live feed will keep running. So if we could all turn off cameras and mute microphones before we return. Thank you.
Okay, thank you.
Thanks for that. Will do.
Complete the meeting. So, Simon, without further ado, I'll refer to you. If you wait a few seconds for the computers to pick you up, and I'll tell you when you're live.
Many thanks, Leader.
You are now live.
I think I'm live now, and Leader, with your permission, I've shared a presentation. I hope that's visible to the people watching, and many thanks for your tolerance of a challenging diary today. I'll go through some data quite quickly, but obviously happy to take any questions. It'll be on the usual format. Following that, I'll talk a little bit about community testing, vaccinations and new strains, which I think will be of interest to this board. This map is showing the one that shows the pandemic across the country. Just note the new scale here, so it's not that rates have gone up, they've actually come down, but I think to show distinguishing rates in different areas, we can see that the rates have gone down, so that will be the new scale that we use going forward. So really positive picture. Across the country, we've seen a fall in infections across the patch, and I'll now bring that down locally. So we can see for the Isle of Wight that our latest data is 123, so this is our 7-day rate of all ages. and that's come right down, and our case detection rate is 83 per 100,000. Again, you can see those drops are really good news, that we see those drops. And our positivity, which is now under 5, and if you've got a positivity rate, that's the number of people who've tested with symptoms who come out as positive for coronavirus, because we know there's other illnesses that look like coronavirus without a test, and that's at 4.1 and falling, so that's really good news. And that mirrors the picture we see in the local Hampshire and Isle of Wight area, that actually rates are falling. The Isle of Wight has fallen very fast, which is absolutely brilliant news. So when we look at testing, we can see the number of people, this is our positivity, and you can see that positivity rate coming right down here to, as I said, 4.1 there. So again, you can see across the piece how that testing picture has changed. When we look at our infection rate, just remember in wave 1 we didn't have both lots, we just had pillar 1 testing in hospital, and we can see our peak, which is kind of in early January with a couple of mini peaks there, and it's come right down now, and we can see that rate has fallen, will continue to fall. The grey data isn't validated, so we're very careful in looking at that, but again, over the pandemic, we've seen after our second wave that the number of cases has come down, and that's really with great thanks to the population for following the guidance and advice needed, and all the work. I must thank all my council colleagues for all the work we've done together to do that, to reduce the spread of infection. And really good to look at this as an age profile, this kind of tartan rug here. You can still see the highest is in the working age population, not unsurprising because those are people having to go out for work, and it has really thankfully fallen in that older population. But as I've always said previously, we're concerned about that population because those are the people most likely to have some more severe consequences. So fantastic news that that's fallen as well, and we'll begin to see that in terms of hospital admissions and then the ITU capacity, particularly noticeable on the island, which is great news. So here's our picture of hospitalisations. You can see that the number of cases in hospital has levelled off and it's beginning to fall, which is great news. But that was a huge peak, and we knew from our modelling that it was going to stay high for a few days, and we'll start to see that falling very soon, as it says there. But the data doesn't quite catch up with us. And then sadly, we look at mortality, and we can see that we had an increase in mortality in the middle of January, and that's coming down. And we know that it takes a little bit longer during the pandemic for the mortality to come, for the death rate to fall, because we know that there's almost a lag between cases and hospitalisations and deaths. So great that that has now come down as well. If I move on to a couple of other items other than the data. So community testing, we are setting up our community testing program. We're waiting for confirmation from the Department of Health, but we have submitted a bid for that, and we are waiting for confirmation to take that forward. This is really for asymptomatic people who are front-facing workers to break the chain of transmission. So we know about a third of people have the virus without knowing, they have no symptoms. So it's for no symptom people, and it's just another tool for us to help us to really manage this pandemic. And it's great news that following us going into lockdown, that is available to us to do that. It's for front-facing workers who are listed here below, alongside other Department of Health led programs. So we've now had the portal open up for companies over 50. We've had a change in programs for things like day setting staff, and we've seen other programs for schools. So this is on top of that to really help people to be able to get lateral flow for twice a week, 3 to 5 days apart every week for a 6-week program. If I move on to vaccination, this map here shows the sites across the island. Really good NHS program that's been led there. It's worth saying at this point, and we're moving through the cohorts of people eligible for vaccination. We're doing very well on the island. There's data isn't public on that, but just remember at this point it's about preventing death and to protect health and social care staff and systems to enable us to cope. As you saw in that previous graph of hospitalisations, that actually you know, the hospital had an awful lot of patients in there. We need to reduce that, and that's what the first phase of this program's about. and these are the maps on the Isle of Wight. In terms of the new variants, we've got some new variants there. Pardon me. Sorry, a bit of background noise here. I was just trying to sort that out. A new variant. So these graphs here show the variant which was first found in Kent. Its official name is B1.1.7 VOC, and you can see that has come down across the southeast. It's difficult to get figures at a local level. We know it was on the island, and at the height of the second wave, we knew it was very prevalent on the island.
Yeah.
But currently, we have seen some initial suggesting evidence that there may be a slightly increase in death, but we need to confirm that in findings. We also know there's a South African variant, which does have a higher viral load, and we are just looking at that as well. And I think we heard Professor Van Tam yesterday saying, despite the vaccine not working quite so well with this variant, it does work. So we need to really encourage people to take up the vaccine to prevent spread of that variant as well. And you've seen the work going on in Surrey and Kent for managing those cases and looking at how that's spreading, doing door-to-door testing. And there are other variants, such as the Brazilian variant as well. So we're aware of, they're all kind of new strains of the virus, which we need to be very mindful of to understand. So a lot of research is going on for this. And should we need to do anything further, we'll be prepared to do that at this point in time. That's not relevant for the Isle of Wight. Leader, at this point, I will stop presenting, and as always, very happy to take questions from the committee.
Thank you, Simon. Thank you for that comprehensive, as always, report. I think just some observations. Very pleased to see the numbers coming down quite significantly now. We're now below 100 or 83, as you pointed out, per 100,000, which is starting to head towards where we were some time back now, it seems. Also that the infection rate is reducing, that's really good, and across all ages, which is positive. And with the community testing bid, which we hope will go through successfully, it feels like we're actually getting a kind of a grip. So thank you very much for all that information. I'll go around the group, see if there are any questions. Councillor Hutchinson, any questions?
Only an observation, Chair. I mean, what is happening, I think, is what we hoped and expected would happen with this new, very strict lockdown. And of course, as you pointed out, Simon, the incidence of infection now is appearing mainly in working people, because obviously they are far more exposed than others. I have to say that my main concern is not immediately, because I do believe we will see over the next 2 or 3 weeks that infection rate continue to reduce. And I'm very pleased to see that there are further arrows in the quiver against the vaccine, with some new repurposed medicines being discovered. But I really do worry about what we are going to do when we reach the beginning of April here on the island, and that is the time when all of the hospitality industry starts to open up, when hundreds of people whose livelihoods depend upon the ability to trade. And I think somehow we have to devise a strategy which will help to keep islanders safe and yet allow the economy to recover. Thank you, Chairman.
Councillor Hutchinson, you're absolutely right. How we manage that opening up of society is going to be really key. The government is going to announce its plan on the 22nd of February. We'll look closely at that. But I think the good work we've seen across the council with our regulatory services, with others, about how we manage the summer in terms of opening up businesses. We need to really think about how we replicate that and support people to further manage the spread of the virus, and to get to a place where actually it becomes part of our way of living in a way that enables us to open up the economy as well as prevent spread of the virus.
Thank you.
Thank you, Simon. Thank you, Stuart. Any other questions, Gary?
Yeah, thank you, Leader. It was just a bit of an update for Simon. You mentioned regulatory services. What I did announce to the group earlier is that we're going to start pushing out a series of webinars for businesses, how to open up and remain safe, COVID safe. The press announcement's already gone out in the intervening period. So hopefully that will give a good, safe message to businesses and give us all a bit of reassurance that we can actually start opening up and ways in which to do so. So thank you, Simon.
Just building on Gary's point, Simon, if you are able to be involved with those webinars, that could be very helpful to us. There's 2 dates and times allocated. Councillor Mosdell, Claire.
Yes, Simon, would it be worth reiterating to people what the categories are for people to have their vaccinations? So we hear a lot of the over 80s have been vaccinated and calling for the over 70s. It's always good to give an example, isn't it? I've got a 22-year-old daughter who's on meant to be shielding because she has lupus. So can you just reiterate what the different categories are? So I know I sit here as a hopefully reasonably healthy 52-year-old, and I would much rather that my daughter has a vaccine before myself. So can you just reiterate those categories? Because I'm sure it's not just myself that gets confused with it.
Thank you, Councillor Mosdell. You're absolutely right. We need to think about those categories, and they're done in a really careful order, as you said, for those who are most vulnerable to being ill. So we started with the over 80s, those who work in the health and social care sector, and the over 70s, and we've worked through those really fast. There are still some people left, and the NHS has asked any over 70s who haven't been contacted to now call in to make sure they can get their vaccination. I want to assure everyone that it's the best thing we can do to prevent ourselves getting seriously ill and to further reduce the spread of this virus. Then it will come down to the over 60s and the clinically extreme vulnerable. So there is a clear criteria as it would go down through the phases, and you will be invited according to your eligibility in that group. So we are working through those phases, and I'm happy to circulate the actual details of the different cohorts going forward. But remembering that at this point we are thinking about those older people who are much more likely to be impacted, and as you say, people who are clinically vulnerable will need that. So we're moving that through very carefully.
Thank you for that, Simon. I think I saw the Chief Executive's hand waved, or he's just being nice. I'm not quite sure which, probably the former.
Thank you, Chairman. Chairman, I wonder if I could just make a point and perhaps invite Simon to comment, because I think if we do progress with the mass community testing, which we certainly hope we are going to do and start that quite quickly, my expectation is that what we'll actually start to see is a rise in the number of cases on the island. And I just wanted to manage people's expectations, because that will not be a bad thing. That will be a good thing, because what it'll do is it'll mean the tail of the infection will be a lot shorter than it might have been had we not had access to the testing. And I think what it does is it gives all of those key workers who are currently out there working some security about when they go about their job, as well as some security about when they go home as well. So if we do get to that particular point, we'd want to encourage everybody to take advantage of those tests and really stick to the twice a week for the 6-week period. Simon, I would be right in that assumption, wouldn't I?
Yeah, thank you, Chief Executive. I think you're right. It's worth reminding people that, as I kind of mentioned earlier, we know about a third of cases are asymptomatic. So those people currently won't be going forward for tests, and we won't know that they're spreading it. So they'll be spreading it inadvertently. So what we'll see if we do asymptomatic testing is we'll pick up more of those cases. So actually the numbers may rise a little bit, but what we're doing is breaking the chain of infection, so that then those people are required to isolate, even if they'll feel perfectly well in the main because they're asymptomatic or have no symptoms. But as you say, that will then enable us to bring the end of the pandemic closer, because we've identified more people and we've broken that chain. But it's a really important aspect, alongside continuing the hands, face messages, even if you had a vaccination, because we need to kind of keep those up. And all those measures together will really help us on the island get really on top of this programme, which we have done all the way through. We saw that huge rise in January due to that new variant, which kind of came through society. So a great point made there, Chief Executive. Absolutely agree with you.
Thank you.
Thank you. I'm going to bring Claire back in a moment. I just want to check something then, Simon. So from what you've said and from the question of Chief Exec, it seems there's a period of time now where a whole range of activities are taking place. Vaccination, the community testing, the continued activity by island residents of doing what they're asked, stay home, stay safe, etc. And I'm going to try and pin you a little bit on the time frame. It links into what Councillor Hutchinson said. People will be asking, and indeed are asking, when they think the Isle of Wight will be open for business tourism, which is one of our key areas. It feels to me like we are a little bit early yet. We need to get this combination of activity through. But it sounds to me like if that works well, we could be seeing a positive summer. I'm not trying to raise expectation, I'm trying to manage it. But we won't be, for example, inviting people for February half term, which I've made very clear. And probably we won't be inviting people over for Easter. I don't know if that's your perception of it. I'm not putting you on the spot, but just trying to get a time frame.
Councillor Stewart, it's a really difficult question, isn't it? Because with this pandemic, we've seen a number of things happen over this year, including, as I just mentioned, the new variant. I think we need to be really cautious and look at the rate of infection and manage that really carefully. I think you're right about February, that actually, you know, we'll still be in lockdown then, as far as I understand. So actually, people need to stay at home. As we move out of that, we need to think really cautiously and carefully. I think linked to Councillor Hutchinson's point, how do we really support businesses to open up carefully? We absolutely want all our children to be able to get back to school, because currently they're just open for key workers and vulnerable children, and that'll be the first point. But things around that have changed. So now schools have the lateral flow tests, and we'll be rolling out programs like that. So, and as more vaccination programs roll out, we will start to see the impact, I would think, in the next few days of actually a reduction in infection due to people not getting so sick. So I think we need to monitor that. We'll continue to have this board as appropriate going forward, so that we can really be briefed to make sure those decisions going forward. But I would think in the summer we'll be in a place where we can really look forward to some kind of summer.
Thank you, because I was going to invite Mr. Hancock to rebook his holiday and come to the island. Claire, sorry.
Yes, I'm not sure who would like to answer this question. So I'm not sure if it's for Mr. Brian Metcalf or for Wendy Pereira. It's really about construction sites. So we've seen the press release and we've heard all about the testing going out for companies that have over 50 employees. You could probably go on to many construction sites on the Isle of Wight today, and probably there will be 20 to 30 people working on that site, but actually most of them will be individual businesses. So they will be the plumbers, the electricians, the decorators, but they will all be on that site progressing some of these sites who have never stopped working, because that was government instruction. Construction sites have always worked. How are we going to be able to encourage those people to have a test? How will we help them do it? Because although I run an electrical contracting company, we only have three people working for us, and some of the paperwork can be really complicated. So how do we support people to get those tests? How do we do that? Sorry.
Good question. Good question.
There's a very simple online booking system for getting a test, and so that will be up and running so people can book on. And because the example you've just given around electrical workers, they are front-facing workers, they are having to go to work. I'm not aware you can do that from home, so therefore they are eligible, and we should encourage them working with the businesses to really also promote that they want their businesses to take that forward.
Thank you. Wendy, do you want to? Sorry, Claire, just let Wendy answer and then I'll come back to you. Wendy?
So I was just going to, adding to what Mr. Bryant was saying, we're going to do a strand of work straight out to businesses to provide information on what's available and how to access it, as well as making information publicly available to employees of those businesses as well. So part of the workshop that Regulatory Services will be running will be to provide additional information over and above that which we will be sending out in a pack to employers in any case. But as Mr. Bryant has said, it will be a very easy booking system, and it will be a matter of turning up and then you go through the process on site, and everything happens when you're on site. There's nothing further from an employer's perspective around registering people. It's down to the individual.
Brilliant,
Okay.
because as we know, when you are self-employed, time is money. I mean, if you're a self-employed decorator and you are that business as a whole, what you're not going to want to do is go to a site twice a week to actually be tested. So, there are some real practicalities that need to be, made clear to people on how they can get tested.
Do you want to come back on that, Wendy, or what's that?
Yeah, I think it's probably worth mentioning that just for the moment, it will be about accessing a site. And it takes 30 minutes from when you have your tests to when you get your results. We are working on whether or not that model can be made more flexible, but that depends on national guidance and national thinking around how we can move testing to specific sites. But there's further work that needs to be done on that to ensure that that can happen.
Yeah, thank you. As long as we can get those messages out clearly, the numbers to call, how they can access this, and we do need to make it really clear, because as Councillor, I'm calling him Councillor, as Mr. Metcalfe said, we do need to get the tail end of this infection. We do need to actually make sure that all those people can have access to testing on a regular basis.
Chief Exec, did you want to come in, or again, were you just waving on?
Thank you, Chairman. If I could just come in, because I do think, as Mr. Bryant and Mrs. Pereira have said, we've not yet got the go-ahead from government to start this testing. However, we are ready to go as soon as we get that go-ahead. So, for those businesses and those frontline workers who may hear about the testing through this particular broadcast or this particular meeting, I would really urge them to keep a lookout in the media over the course of the next 2 or 3 days, because as soon as we get the ability, or as soon as we get the go-ahead, then we will start, and that could be as early as next week. So we are ready to try and roll that out, because it is so important. I think I also wanted to add to Mr. Bryant's point about the Easter period and the summer, and I think my only word of caution is that so far we've worked really hard to get numbers back under control on the island. Yeah. And I think that's the whole community have put so much into that. What we would need to understand is what the national picture looks like as well, because that clearly is going to have an impact on what we can do in terms of reopening businesses without having going through what we just went through in December and January in terms of further increasing cases. So there's a mix and match approach that we need to put into place. But I do think, and I did say this before, I do think that great credit had to go to our businesses as we came out of the last lockdown, because I think a great many did work in a really, really COVID secure way, and I'm sure they will do so again. And I've got a further question that has been asked of me to ask of Mr. Bryant. Over 70s, Simon, who've not yet or who have been encouraged to ring up if they haven't had a vaccine, they've got to ring 111. Oh, is it 119 they have to call, or 111? Do you know?
I haven't got those details in front of me. I suspect it's 111, but I can check that out and make sure we get that information out for people.
Terrific. Thank you. Thank you, Chairman.
Thank you. I'm just going to try and summarise that, because I think for me this feels a bit positive in many ways, that we've had the figures which Simon has publicly showed us today, which is good news. I'm sure there are many people on the island we're pleased to see that our figures are coming back to something near where we had got to from the crazy level we reached. The vaccination programme, as I understand it, is going well, and we are at least up with the national picture. So we're contributing well, and people are getting vaccinated. That's good, and I would encourage people to do that. That we've now got a community testing initiative, which, if it all comes to plan, will actually be hunting the virus down almost, which means we're on the positive front. And all those things coming together, as well as people fully understanding the need to stick to the rules, stick to the guidance, stay at home, etc., etc. It feels like at long last the island is moving forward in that way, but we have to remember it's a slow process, and it doesn't take a lot, as we learned at Christmas, for it to all go horribly, horribly wrong. So I think that feels good. So my message publicly is going to be stick to the rules, stay at home, protect the NHS as we always do, and save people's lives. And actually, we'll let you know when the time's right to do differently. And I think this activity with the businesses, which Gary's referred to, and others, is all a sign that we're slowly building our plan forward. And it will just take time. But it would be really nice to think if everybody does what they need to, we are looking at a brighter summer, a managed summer probably, I suspect, but nevertheless a brighter summer. And so that's good news. So thank you everybody for everything that's going on. With a front face at the moment, there's a lot of people working very hard behind the scenes. Okay, I think we've covered the items on the agenda. It's members' questions, but we don't have any written members' questions I'm aware of. So I'm going to call the meeting to a close and thank you all for your time today.
Many thanks, colleagues.
Thank you, Chairman.
Thanks very much.
See you all this evening.
Yeah.